Hello, good morning. This is Dr. Khadija once more. I want to thank you so much for viewing my first two videos. In total, I have close to 200 views and I appreciate very much. And so I'm going to do another video today and it's going to be different from the family series. I just want to take a break. So today's video, I want to focus on something that I realized was of big importance to most Kenyans and in their lives. So I was running the fertility clinic in my hospital, the hospital that I'm based in since the year began, I think from February, March, until Corona chased us away. So I used to get so many patients who would come in and tell me that we are so and so, we've been married for 2 years, we've been trying to get a child in those 2 years and it's not been successful. What's going on? Do you want to know who has a problem and deal with it? So my first question would be, so do people live together? How is your cycle? Do you have a regular cycle? Do you ovulate? Are you active during your fertile window? And most women will look at me with a lot of surprise. They'll be like, what is the fertile window? What is my safe period? I don't know anything about this. And it may seem like a shock to most of you, but yeah, many women in this country do not know anything about fertility windows. So I will get patients who stay far away from their spouses, and then every time they meet, it's like end month or the 4th week of the month, which most of the times will correspond to that woman's safe period. And so there is no way you're going to get pregnant despite the number of years that you keep on trying. And at the same time, this reminds me of another scenario. Like I remember one time I was buying drugs in a chemist, and one girl came in and she wanted to purchase the emergency contraception pills. These are called the Plan B pills or the high dose levonorgestrel pills. And I was very surprised that the shopkeeper the dispensing pharmacist did not ask anything about her window. And so the place was a bit busy, so I called her on the side and I pulled her aside and asked her questions. And I was like, so my name is so-and-so. I saw you asking for an emergency pill. I wanted to ask you a few questions, like when was your last period? And were you in your fertile window? When did you ovulate? How regular is your cycle? And the girl got very offended, of course, but she answered the questions either way. So she told me that this was my last menstrual period. I have a regular cycle of 28 days, and I was able to calculate. And I was like, so why are you taking the emergency contraception pill? And she was like, no, I don't want to get a child right now. I messed up. And I was like, but you don't need to take the pill. You're in your safe window. If whatever happened yesterday. And of course she didn't believe me, and she was like, nikipata mtoto utalea and I don't even know you. And sadly I saw her buy the pills, and she didn't need the pills. Like, there's no science behind her taking that pill during her safe window. There's no way you can get pregnant during your safe window. And this pill is a high dose progesterone pill. It acts through thinning the endometrium and making the mucus plug at the cervix. Cervix is the entry to the womb. Makes it very, very thick, so sperm will not be able to penetrate. And if in the setting of an emergency pill, it acts by thinning the wall of the uterus. So even if a baby is formed, the baby will not have a receptive ground to implant and develop. And then also, if you have not ovulated, it stops ovulation. So if, for example, you are like 2 days to ovulation and you have taken this pill, it will stop ovulation, so stopping pregnancy. But again, that pill has its own side effects. Like, for example, it can mess up your cycle. It can impair ovulation also in subsequent months. Yeah. And if pregnancy results from such a pregnancy where you have taken the emergency contraception pill, chances are that it will be an ectopic pregnancy. And ectopic pregnancies are dangerous, they can kill. So I talked to this girl and she didn't understand. She didn't want to understand. I think her mind was fixated on her taking the emergency contraception pill. And so I told her, it's okay. So this is my number. If you have any questions, you can call me. And she was like, you're a stranger. I met you in a chemist. Like, how do I know that you're not lying to me? Either way, she took the pill. She didn't need she didn't need to take the pill, but she took it either way. So, so what is a menstrual cycle? So a menstrual cycle, every woman has their own calendar. From the day of the first day of your menses, that is day 1 of your calendar, and some women have 28-day menstrual cycles, and other women have 26 days cycles, and other women have 35-day cycles. So a normal cycle would vary from 26 days to 35 days. So the last day of the cycle is the day before your next period, right? So most women, about 50 to 60% of the population would have a 28-day cycle. I hope you're together right there. So this menstrual cycle of a woman is divided into 2 phases. Okay, so there's that phase whereby you are having your periods. Okay, so that's a menstrual phase, and then after you get your period, for the next few days, like up to ovulation, and I'm going to talk about how you calculate all this. So up to ovulation, that is called the proliferative phase of your cycle. So that is a high estrogen state. So what happens? It's a whole many curves combined together. There's you can mention names according to if you're talking about it from the ovarian side or if you're talking about it from the uterus side. So I'm going to talk about it about from the womb side, and womb is uterus, and also putting in one or two statements about what happens to the ovary at that time. So the first day of your period, once you start your cycle, so your ovaries are also recruiting follicles, because a woman has so many follicles, so many eggs, but there's only that one egg that is usually released for you in every month, in every cycle, if you're ovulating, that is. So this phase is usually under a hormone called FSH. And then, so you get your periods up to, let's say, 4 days, 5 days, 6 days, depends on your menstrual cycle. And then after that, we have what you call the proliferative phase. So this is a high estrogen state. So it tends to repair the damage or the sloughing off of the wall that happened when you are bleeding during your periods. Okay, so at the same time, so the estrogen is repairing the uterine cavity, and at the same time, your ovary is recruiting an egg to be released in this cycle. Then in the middle of your cycle, there's what you call ovulation. So a day or so to ovulation, there will be LH surge. LH is luteinizing hormone. So there will be a shoot of this other hormone called LH that will cause your ovaries to release that one follicle, a dominant follicle, that one egg that was recruited with its follicle, and it grew and it's ready for expulsion. So it expels from the follicle. Follicle is a covering that covers and protects the egg, the ovum. I'm trying to make it very layman's. So after you ovulate, so ovulate is you have released an egg, right? So this happens in the middle of the cycle. So if you have a 28-day cycle, it will happen on the 14th day of the cycle, okay? And then after that, now the follicle or the covering or the protective, so a follicle is, so an egg will be covered by like a shell. Like, let's say, like the way you see a chicken egg, it has an egg inside, then it's covered by a shell. So let's think about it that way, that the egg has protruded out, then its covering has been left somewhere in the ovary. So that covering will be responsible for producing a hormone called progesterone. So this progesterone will now lead us to the next phase, which is called the secretory phase. Or if you're talking about it from the ovarian side, it's called the luteal phase. So it's called a corpus luteum, whatever has been left, the shelling that had been left after the egg was expelled out. So this will cause, so the shell that is left is called corpus luteum. That's why it's called a luteal phase from now onwards, if you talk about it from the ovary side. And if you talk about it from the uterus side, it's called the secretory phase. So at this stage, a hormone called progesterone is produced, and it will cause your uterine wall, the inner lining of your uterus, of your womb, to be very healthy and with very many vessels, and to be well supplied with blood, and to be thick, preparing for implantation, for a baby to attach. So if no fertilization occurs towards the end of this cycle, now you go into your next cycle, so you will bleed, right? So if there's no baby formed, there's no fertilization that has happened, the corpus luteum will shrink, progesterone will dip down, and then this wall of the uterus will slough off, and you'll start bleeding. That's menstrual cycle, okay? So this I've talked about. So this was just a brief introduction about it. So you said you have your day 1, that's when you're bleeding, right? So at this stage, your ovary is preparing a follicle. At the same time, you're bleeding. Then after you bleed, there will be estrogen, right? So that will be repairing the damage that has been caused by the shedding off during menstrual bleeding. At the same time, in the ovary, this one egg that was nominated to be the one released for this cycle has grown, has matured, okay? And then during the 14th day of the cycle, if you have a 28-day cycle, there'll be an increase in a hormone called luteinizing hormone, LH, that will cause this egg to be expelled. Then the covering of the egg will form what you call corpus luteum, and corpus luteum will produce progesterone that will help the wall to be even more beefed up, the uterine wall to be, very well vascularized, that is good blood supply. The wall will be very thick and good and healthy, just in case a baby is formed, and the baby will come and implant there, right? If a baby is not formed, if fertilization does not happen, the corpus luteum will shrink, progesterone levels will go down, then you'll shed off, and that will be the beginning of your next cycle. So what happens if you have, so this 14th day in a 28-day cycle, that's when you're producing an egg, right? So chances are, if you get busy around this time, you will get pregnant. So there's one thing that I want everybody to have it very clear, that a male sperm can stay inside a woman's body alive and well for 5 days, right? So if you get busy, like 5 days before you produce an egg, 5 days before your ovulation time, 5 days, then the sperm can still be alive inside the woman's body, inside a woman's reproductive tract. And with this I mean up there in the fallopian tubes. And so if an egg is produced and an egg comes to the fallopian tubes and finds a sperm there, even if the sperm was deposited there 5 days prior, chances are that you'll get pregnant. But of course, we normally say the chances of success are higher if sperm deposition happened towards your ovulation time, or during or on the day of your ovulation. Okay, is that clear? On the other hand, a woman's egg, ovum, can only survive for 12 to 24 hours. 12 to 24 hours. A sperm can survive in a woman's reproductive tract for up to 5 days, that is up to 120 hours. But a woman's egg or ovum can only survive for 12 to 24 hours, okay? So if you have ovulated and then you have sex the next day, chances are that you'll get pregnant. Are we together up to there? Okay, so 5 days before your ovulation time, 5 days before ovulation time, and 1 day after your ovulation, this constitutes your fertile period. Okay, so if you have intercourse, etc., like way after these days or way prior to these days, then there will be a very, very, very minimal chance of pregnancy. Very minimal, up close to zero or even zero. So how do you calculate the window in a woman who does not have a 28-day cycle? So for example, if you have a 26-day cycle, and women should track their cycles, you don't need an app, but an app makes it easy. You can even tick it on your calendar. You can put like some red dots to mean that this is the time that I started bleeding, this is the time that I bled, this is the time that I had the next bleeding, so you can be able to tell, to tell about your cycle. So if, for example, you have a 26-day cycle, we normally say the second phase of the cycle after ovulation is usually constant for everybody. So it's about 13 to 14 days. So after you ovulate, remember you said ovulation, you form corpus luteum, produces progesterone, you're preparing for a baby to implant, right? So this is usually constant 14 days. So how you need to know your ovulation time, you calculate it backwards. So if you have a 28-day period, you take 28 minus 14, so the 14th day will be your ovulation time. If you have a 26-day cycle, and we normally say that this secretory phase is usually constant, 13 to 14 days. You mostly use 14 days. So if you have a 26-day cycle, you take 26 minus 14, right? You get what? 12. So the 12th day is a day that you most likely ovulate on average. It will be the day that most likely, a day before, a day prior, or a day after, that is the time that you'll be ovulating. If you have a 35-day cycle, you take 35 minus 14, you get what? 21, right? So the 21st day will be your day of ovulation. So you'll calculate your window by taking 5 days prior and 1 day after. So if you're busy in that week, then chances are that you'll get pregnant. So the girl that I was talking about that I met in the chemist, like I don't know her name, I don't even know her. She was way past her ovulation window, close to her next period, right? So there was no way that she was going to get pregnant. But she still took the emergency pill because she did not have information. Okay, so I hope this is clear. So it's important for a woman to know their cycle, know your cycle length, know how many days you get your periods, know if your period is regular, if your cycle is regular or not, know when you ovulate, and know your fertile window. Hope this is clear. So there are many apps that can help a woman do this. If you are too lazy to tick it on your calendar, you can have an app that will think for you and calculate this for you and even alert you. So there are many apps. Like in my clinic, I have helped patients to download like the Clue app, CLUE. I'm not advertising, so this is just what I know. And there's a Glow app, right? So the Clue app, it will want to track your cycle for a few months, a few cycles, so that they can tell, or maybe you will be able to record your previous cycles if you remember, and that will be able to help the app predetermine everything. So you only need to key in the first day of your period to your last day of your period and the next day of your period, the next time your period comes. So this way they're able to calculate your cycle, and depending on your cycle length, they're able to predict and tell you that this is your ovulation day. So this is your ovulation, this is your fertile window, this is your safe window. I hope this is clear. Okay, I'm going to share some pictures that will help guide you in this video. So for any questions, please write below, or you can inbox me on my Facebook, that is at Dij Musini, Dij D-I-J Musini, M-U-S-I-N-E, or you can email me at mbenekakhadija@gmail.com. Thank you very much, and subscribe and share this video with as many people as possible. Let's educate, let women know about their bodies, let women know about their cycles, let women know about their reproductive health and their cycles. So thank you very much and have a good day. Bye-bye.